NMC CBT questions and answers. Question number 601. The code is the foundation of Option A, dress code. Option B, personal document. Option C, good nursing and midwifery practice and a key tool in safeguarding the health and well-being of the public. Option D, hospital administration. The correct answer is option C, good nursing and midwifery practice and a key tool in safeguarding the health and well-being of the public. Question number 602. A patient has been assessed as lacking capacity to make their own decisions. What government legislation or act should be referred to? Option A, Health and Social Care Act, 2012. Option B, Mental Capacity Act, 2005. Option C, Carers, Equal Opportunities Act, 2004. Option D, all of the above. The correct answer is option B, Mental Capacity Act, 2005. Question number 603. Which of the following statements is false? Option A, abuse mostly happens in nursing and residential homes. Option B, abuse can take place anywhere there is a vulnerable adult. Option C, abuse can take place in a daycare center. Option D, abuse can be carried out by anyone: doctors, nurses, carers and even family members. The correct answer is option B, abuse can take place anywhere there is a vulnerable adult. Question number 604. Christine cannot get herself a drink because of her disability. Her carers only give her drinks 3 times a day so she does not wet herself. What type of abuse is this? Option A, physical abuse. Option B, institutional abuse. Option C, neglect. Option D, sexual abuse. The correct answer is option C, neglect. Question number 605. Training of student nurses is the responsibility of Option A, ward in charge. Option B, senior nurses. Option C, team leaders. Option D, all registered nurses. The correct answer is option D, all registered nurses. Question number 606. A community health nurse with second-year nursing students is collecting history in a home. Nurse notices that a student is not at all interested in what is going around and she is chatting in her phone. Ideal response. Option A, ask the student to leave the group. Option B, warn her in public that such behaviors are not accepted. Option C, inform to the principal. Option D, talk to her in private and make her aware that such behaviors could actually belittle the profession. The correct answer is option D, talk to her in private and make her aware that such behaviors could actually belittle the profession. Question number 607. You are mentoring a third-year student nurse. The student requests that she want to assist a procedure with tissue viability. Nurse, how can you deal with this situation? Option A, tell her it is not possible. Option B, tell her it is possible if you provide direct supervision. Option C, call to the college and ask whether it is possible for a third student to assist the procedure. Option D, allow her as this is the part of her learning. The correct answer is option B, tell her it is possible if you provide direct supervision. Question number 608. Who is responsible for the overall assessment of the student's fitness to practice and documentation of initial, midterm and final assessments in the ongoing achievement record? Or, option A, the mentor. Option B, the charge nurse manager. Option C, any registered nurse on same part of the register. The correct answer is option A, the mentor. Question number 609. A nurse educator is providing in-service education to the nursing staff regarding transcultural nursing care. A staff member asks the nurse educator to describe the concept of acculturation. The most appropriate response in which of the following Option A, it is subjective perspective of the person's heritage and sense of belonging to a group. Option B, it is a group of individuals in a society that is culturally distinct and has a unique identity. Option C, it is a process of learning a different culture to adapt to a new or changing environment. Option D, it is a group that shares some of the characteristics of the larger population group of which it is a part. The correct answer is option C, it is a process of learning a different culture to adapt to a new or changing environment. Question number 610. According to the Royal Marsden Manual, a staff who observe the removal of chest drainage is considered as option A, official training, option B, unofficial training, option C, hours which are not calculated as training hours, option D, it is calculated as prescribed training hours. The correct answer is option B, unofficial training. Question number 611. Which task should be assigned to the nursing assistant? Option A, placing the client in seclusion. Option B, emptying the Foley catheter for the preeclamptic client. Option C, feeding the client with dementia. Option D, ambulating the client with a fractured hip. The correct answer is option C, feeding the client with dementia. Question number 612. A nurse demonstrates patient advocacy by becoming involved in which of the following activities? Option A, taking a public stand on quality issues and educating the public on public interest issues. Option B, teaching in a school of nursing to help decrease the nursing shortage. Option C, engaging in nursing research to justify nursing care delivery. Option D, supporting the status quo when changes are pending. The correct answer is option A, taking a public stand on quality issues and educating the public on public interest issues. Question number 613. A client experiences an episode of pulmonary edema because the nurse forgot to administer the morning dose of furosemide, Lasix. Which legal element can the nurse be charged with? Option A, assault. Option B, slander. Option C, negligence. Option D, tort. The correct answer is option C, negligence. Question number 614. What is accountability? Option A, ethical and moral obligations permeating the nursing profession. Option B, to be answerable to oneself and others for one's own actions. Option C, a systematic approach to maintaining and improving the quality of patient care within a health system, NHS. Option D, the process of applying knowledge and expertise to a clinical situation to develop a solution. The correct answer is option B, to be answerable to oneself and others for one's own actions. Question number 615. While at outside setup, what care will you give as a nurse if you are exposed to a situation? Option A, provide care which is at expected level. Option B, above what is expected. Option C, ignoring the situation. Option D, keeping up to professional standards. The correct answer is option D, keeping up to professional standards. Question number 616. In using social media like Facebook, how will you best adhere to your code of conduct as a nurse? Choose two answers. Option A, never have relationship with previous patient. Option B, never post pictures concerning your practice. Option C, never tell you are a nurse. Option D, always rely solely in your FB's privacy setting. The correct answer is option A, never have relationship with previous patient, and option B, never post pictures concerning your practice. Question number 617. NMC defines record keeping as all of the following except option A, helping to improve advocacy. Option B, showing how decisions related to patient care were made. Option C, supporting effective clinical judgments and decisions. Option D, helping in identifying risks and enabling early detection of complications. The correct answer is option A, helping to improve advocacy. Question number 618. Information can be disclosed in all cases except option A, when effectively anonymized. Option B, when the information is required by law or under a court order. Option C, in identifiable form, when it is required for a specific purpose, with the individual's written consent or with support under the health service. Option D, in child protection proceedings, if it is considered that the information required is in the public or child's interest. The correct answer is option A, when effectively anonymized. Question number 619. The nurse executive of a healthcare organization wishes to prepare and develop nurse managers for several new units that the organization will open next year. What should be the primary goal for this work? Option A, focus on rewarding current staff for doing a good job with their assigned tasks by selecting them for promotion. Option B, prepare these managers so that they will focus on maintaining standards of care. Option C, prepare these managers to oversee the entire healthcare organization. Option D, prepare these managers to interact with hospital administration. The correct answer is option B, prepare these managers so that they will focus on maintaining standards of care. Question number 620. What do you mean by a bad leadership? Option A, appreciate intuitiveness. Option B, appreciate better work. Option C, reward poor performance. The correct answer is option C, reward poor performance. Question number 621. There have been several patient complaints that the staff members of the unit are disorganized and that no one seems to know what to do or when to do it. The staff members concur that they don't have a real sense of direction and guidance from their leader. Which type of leadership is this unit experiencing? Option A, autocratic. Option B, bureaucratic. Option C, laissez-faire. Option D, authoritarian. The correct answer is option C, laissez-faire. Question number 622. When group members are unable and unwilling to participate in making a decision, which leadership style should the nurse manager use? Option A, participative. Option B, authoritarian.
Option C, laissez-faire.
Option D, democratic. The correct answer is option B, authoritarian. Question number 623. One leadership theory states that leaders are born and not made, which refers to which of the following theories? Option A, Trey. Option B, charismatic. Option C, great man. Option D, situational. The correct answer is option C, great man. Question number 624. Which of the major theories of aging suggests that older adults may decelerate the aging process? Option A, disengagement theory. Option B, activity theory. Option C, immunology theory. Option D, genetic theory. The correct answer is option B, activity theory. Question number 625. The characteristic of an effective leader includes option A, attention to detail. Option B, sound problem-solving skills and strong people skills. Option C, emphasis on consistent job performance. Option D, all of the above. The correct answer is option D, all of the above.